Good morning, everyone, and welcome to our virtual supply chain forum. We wish we could be with you in person, but we're grateful for the opportunity to have these technologies to bring to you this digital content. So today, we're going to jump into our panel on views from the top. So I have a series of healthcare supply chain leaders with me, whom I will introduce momentarily. But we want to make sure that you actually have an opportunity to engage in the dialogue and the conversation today. And so there are a couple of ways you can do this. If you have the Supply Chain Forum app, you can go into the app and select the Slido feature. And there, that should give you the ability to see the questions that have been posed, as well as pose any questions you might have, or you can upvote to co-sign on questions that have already been asked by another attendee. The other option you have is to open your web browsers and go to slido.com. And when you go there, it will ask you for the event code. And today's event code is GSCI 2020. So that's all caps, GSCI 2020, one phrase together. And that will allow you to engage with us as we move through this conversation. Also want to take the opportunity to let you know that in addition to today's session, we will also have a fabulous session tomorrow on the implications of COVID-19 on the US economy. And that session will be spearheaded by our very own Marianne Wanamaker and our Department of Economics. And that will be Thursday, the 16th from 10 a.m. to 11 a.m. Eastern time. And so we welcome you to join us again tomorrow for that particular session. So without further ado, let me introduce you to the panelists that we have joining us today. So we have joining us from Pharmalink, we have Gil Canner. Gil is the VP of Operations for Pharmalink. And then we also have with us Cynthia Valaitis. Cynthia is President and CEO of HealthPRO Procurement Services in Canada. And we have Régine Villain, who is the Senior VP of Supply Chain Network, as well as the Chief Supply Chain Officer of Ochsner Health Systems in New Orleans, Louisiana. And so I want to thank Gil, Cynthia, and Régine for joining me today. And I can tell you this, they are not only fabulous people, but they're the people that I have the utmost respect for. And I'm not the only one who consider them thought leaders, but they are, I would say, well known, both domestically and internationally. So you are definitely in for a treat today. All right, so Gil, let's go ahead and jump into this. And if you will, I'm going to start with you. If you would think back to the fourth quarter of 2019, before COVID-19 was really on our radar in North America, and just kind of paint a picture, what would you say were some of the top supply chain concerns or goals, initiatives that you had at Pharmalink?
I'd have to say that the biggest thing we were looking at is how to continue the growth we had going on. And we were looking at different ways of automation and, thinking smarter and not, going out as we're growing and hiring, one for one on the percentage of growth, new employees. So it was an initiative to think smarter and work, less hard at what we're doing. And, that's why things like Modex were going to be important and some of the other things that were going to be coming up to be able to look at the technologies out there. And obviously, things have changed to some degree, but we are still growing.
So Gil, also, many may not be familiar with Pharmalink and what it is exactly you do and where you fit in terms of the healthcare or pharmaceutical supply chain world. So could you give them just sort of a brief synopsis of where you sit in the end-to-end supply chain?
Sure. We're a reverse distributor of pharmaceuticals, and technically we don't distribute anything. All we do is take back product that's outdated and expired and handle it according to the manufacturer's policies, with 100% of what we're doing ending up being disposed of through, proper methods, mainly incineration. And, we apply for the credits for the customers that are returning the product. A lot of people don't realize that expired product still has credibility with the manufacturers. So there are roughly 54 people or 54 companies that are in the reverse distribution of pharmaceuticals. And we are currently either number 2 or number 3 as far as size of the operation. And, we deal with manufacturers, wholesalers, independent pharmacies, hospitals, clinics, anyone who has product that's expiring and has no proper way to dispose of it, but also have the ability to get the credit that they deserve for that product.
Okay, thank you. So Cynthia, I'll pose the same question to you with respect to when you think about fourth quarter of last year, what were your goals, aspirations, and what were you thinking about, and also help our attendees understand the context in which HealthPRO plays.
So the context is we are a national group purchasing organization. So similar to those that you have in the US, like Vizient and them, we aggregate the volumes of mostly consumable commodities used in hospitals from coast to coast and put contracts in place. So we don't buy products, we don't warehouse, we don't redistribute, we put the contracts in place and manage them. I think last year we were very focused on raising the level of awareness of who we are and what we do to both provincial and federal governments. We've really operated under the radar. We are a member-owned organization, so while the healthcare organizations know who we are, I don't really think government had a good appreciation of the role that we play. And interestingly, a lot of the work that we were doing was advocating for why the national aggregation of volumes was so important, and that the disaggregation of volume was dangerous because you lose sight of the supply chain and the potential risks of disaggregating volumes and reducing the number of suppliers in the marketplace, which I don't think we realized how important that was at the time, as we realized just a couple of months later. But that was our focus, and from an operational standpoint, I think everybody was really excited about the Cardinal isolation gown recall, and somehow that doesn't seem to be on the headlines anymore.
That's true. So Régine, and what about you down in New Orleans, one of the hot spots? So let's take us back before it was actually a hot spot in terms of COVID.
Thank you, Randy. So let me just say a little bit about Ochsner. Ochsner is Louisiana's largest not-for-profit hospital system, and we're the largest private employer in the state, about 26,000 plus employees. We have 16 owned managed hospitals, 20 affiliated hospitals, and about 5 specialty hospitals with over 120 health centers and 20 plus urgent centers in the system. So I am definitely right in the middle of it. But interestingly enough, when you're talking about December, in December, I hadn't been quite there a year yet. I started at Ochsner in February of last year. And so for me, planning this year was about continuing to solidify the supply chain operation within the organization. But also, very interestingly, I had a goal to optimize my channel sourcing. And so once I started to look at the way that we're doing business, and then, realizing that we're doing business with some very big companies, I wanted to make sure that we could diversify our channels. So my goal for this year was to make sure that we're strengthening the supply chain organization, that we were probably going to be looking at a little bit of self-sufficiency, but further down the road, but really about making sure that we are establishing those external relationships with some key strategic vendors, and also at the same time, just, the supply chain organization within Ochsner, trying to make sure that I was aligning myself also with the organization. So that was like the big goal for me, still being newish at Ochsner, wanting to just continue to do some of the great things that we had started to do last year.
And so I'm sure as we get deeper into our conversation today, we'll hear a little bit about how those efforts that you were spearheading at that time actually are now paying dividends in a time where many organizations find themselves extremely underprepared for the pandemic that we're facing. So let's shift just slightly to talking a little bit more about the pandemic, COVID-19, and the impact it has had on your operations, your personnel, as well as healthcare in general. So Cynthia, I'll start with you.
Sure. Well, one of the things that we were also talking about around Christmas was how we wanted to expand our office space so that we could get everybody more comfortable in the office. And the very quickest realization we had when we all went to work from home on March 16th was that it was kind of working pretty well. So we're going to completely switch our focus to not having everybody in the office and looking at a different way of doing business. So I think that's been a really interesting thing from an organizational point of view, that we've been, I think, more efficient. I think some have been happier. So it's just a complete different organizational shift. Obviously, as the CEO of the organization, one of the things that I've needed to do is make sure that I keep my board of directors apprised of what we're doing, that we're not combusting under the stress and weight of the things that are happening with respect to COVID-19. But from a HealthPRO perspective, and I just lost track of what it was that you were asking, from in terms of the work that we're doing is really facilitating the provision of information to the members. Mm-hmm. So while we're not out there looking for products in China and buying products and redistributing it, we are providing a website where all of the information that we have to support the members is provided as a facilitator of really knowledge sharing, I would say. And also finding a way to continue to do the business at hand without letting COVID-19 completely shut down what our business is, and our business is actually going to market and making sure that there are contracts available for our members once this all settles down to a certain degree.
Okay, thank you, Cynthia. So Régine, this is following up on the point that you were making in terms of those initiatives that you had underway once you joined in February of last year. As a result of those, how has COVID really impacted your operations, and recognizing that you represent so many different hospitals? If you can speak in general, or you can speak to some of those in individually, if you like, and also talk a little bit about the personnel so that people can truly understand and appreciate not only what they're doing, but what are they really exposing themselves to, and what does this mean for us as an industry moving forward?
So thank you, Randy, for that question. So basically, you know me, and for those of you who don't, I take everything with, gusto, and I just, I'm passionate about the business of supply chain, because the way I look at this is an opportunity for us, within the supply chain to really take care of people in a way that is not necessarily seen at first, but we are the people who are providing all the things that, are needed really in order to care for those patients. So with that optic in mind, what I had been doing with the organization, with the supply chain folks, was to continuing to make sure that we're connecting to purpose. We're here for a purpose. And so it's about the true north is our patients, and everything that we're doing is going to have to support that. And so with that, some of the changes that I had already established in terms of creating clear lines of delineation for accountability within the supply chain, but still with the horizontal integration, paid off really well during the whole COVID-19 crisis, because once we were told that we had that first case, it pretty much accelerated from there, from first case to almost like chaos in a matter of 48 hours. And so it was really important to be able to bring the team together and make sure to realize that, listen, guys, you guys have each your areas of expertise, and I'm going to rely on you guys, to make sure that you're leading the way. I'm here to support you. I'm here to make sure that, we're getting the things done that we need to do. We're going to need to add expediently, and we're going to need to do things in a way that's going to be intentional. And basically, no is not going to be the last answer. So we just went in like this, and basically what I had to also do is get myself out of the way to allow for the team members and for my leaders to be able to do the things that they needed to do. So when it came to COVID-19, we were still, some of the first ones. And so a lot of fear, a lot of uncertainties about what to be expected, what's going to happen, what's not going to happen, how are we going to be able to support all the hospitals. As I mentioned, we are, across the entire state of Louisiana. And so it's not just New Orleans, which is where I'm located and where the main hospital is, but it's also thinking about how we're going to support the other hospitals who are further ahead, how we're going to pull ourselves together. Technology played a big role in us being able to also pull ourselves together and start to really act really swiftly. And then the relationships and the networking that, I've been establishing in my career up to this point has really also paid off. It's really about being able to call on the people with whom you've worked with, whom you know, and even though you had a professional working relationship with them, that did not really matter. It was more about how can you help us? How can you make sure that you can support us in a way where we can continue to take care of those patients? And then also being there for the team, making sure that the team knew that as their leader, I was there for them. I was going to step out of the way and I was going to defer to their expertise, because the expertise lied with them, not necessarily with me. I was here to make sure to steer the ship, but really, frankly, making sure that everybody knew that they had a role to play and supported them that way.
Okay. That's one of the more insightful parts, Régine, is we talk about the keys of being a great leader is being able to assemble a fabulous team around you and then being able to deploy the team and empowering the team to do what they do while you become that voice and representative to the rest of the executives and senior leaders in the organization. So it sounds like you've done a fabulous job with respect to that. So Gil, we'll turn to you with very similar questions. When you think about your operations and the personnel and what it means for this segment of this sector that you play in, what does that implication or impact really look like for you?
First of all, we're very fortunate that we're in an essential business, and people say, well, why are returns essential? What makes that essential at this point in time? There's a couple of reasons. One is it's getting space in the pharmacies and the hospitals of things that they need to bring in, and it's not being taken up by product that they cannot use because it's getting to be expired or within their expiration periods. Mm-hmm. The other thing is that pharmacies, whatever, need their cash flow. And by us getting the returns and applying for the returns, they'll be able to get some funding during this tough period, on these returns from the manufacturers. We have been able to stay at almost full staff. We've allowed some people who had child care and other needs to take a furlough, take an FMLA or whatever they needed to during this period. And our business is a little down, but it won't be down because if you think about it, the amount of product expiring and coming out of the supply chain is going to remain the same and maybe even go up during this period of time. And what that means is that we may not see it now, but we may see it when they have more time to go and do what we call shelf sweeps, to look at the products that they need to remove from the supply chain. So it's not like our business is not going to come back. It's going to come back and then some, when this picks up. And in general, we've been seeing, like I said, about 80% of our normal flow of goods coming in, and that other 20% will make itself up once things go back to normal. But we have what we call, we have outside sales and inside sales. Our outside salespeople actually call on the hospitals, the pharmacies, and check their shelves and remove the product and put things together. Right now, a lot of them are not being able to hold their normal appointments. So they're either having their customers do their own returns or they're putting them aside until they can get in and finalize the return. So as I said, it hasn't had a very negative effect on us as far as volume, and we feel like we're doing, an important service. We have a program too that's still in effect, which is an RX take back, where we have kiosks at pharmacies and hospitals where people can return their expired drugs so they don't have them on their shelves at home, and that, they don't misuse them or abuse them in any way. So they bring them back and drop them in these, and we're still getting those returns. So
go ahead.
That's basically where we are. We're concerned about our employees. I actually canned a term yesterday, PPA, proper pandemic accoutrements. So we make sure everyone has masks and wearing gloves and everything they touch and et cetera. But I was tired of PPE, so I changed it to PPE.
So Gil, when you talk about having those kiosks at those various locations and your team being responsible for going out and doing the pickups, have those operations slowed at all in light of this?
In actuality, those are not, we don't go out and do those. We'll go to a pharmacy and do a shelf sweep, but if there's a kiosk in there, it has its own box, it has its own label. As soon as that box is full, the pharmacy has the key to that kiosk. They open it, seal the box, and send it to us with a prepared postage paid label.
Okay. So we had a few questions that are coming in from the attendees, and so I'll turn to this first one here, which happens to deal with the fact that we're seeing this acceleration of telehealth trends. And one of the questions is, what do you see as some of the longer term implications of this? And so let's kind of frame and phrase this for everyone else. So what we've seen with respect to this are relaxed standards with respect to what even constitutes as a telehealth or a telemedicine initiative or intervention. We're seeing guidelines being relaxed such that healthcare providers are now having greater flexibility to practice at the top of their license. So whether we're talking about those who are physicians or those who are what we might refer to as advanced practitioners. And then the other thing that we're seeing is many states relaxing their guidelines in terms of whether or not you're licensed to practice in that state, thereby allowing more healthcare professionals to practice across state lines from a telehealth perspective. And so when we think about those, and I'll allow each of you to weigh in as you see fit, what do you think are the longer term implications with respect to some of these changes? Can we put the genie back in the bottle once this is all said and done?
Well, I mean, I can speak from the hospital point of view. I can tell you that, and it's unfortunate I don't have those numbers, but our telehealth program has seen an incredible boom. I mean, we've gone to, now don't quote me, we were maybe at some point, we were about like 100 and something, 200 people who were like regularly using telehealth. Now we're in the thousands of people who have basically shifted to virtual care. Virtual care is in, it's the thing. It's sexy now. And to your point, I don't know about putting the genie in the bottle, because what this has also shown us is that there are a lot of things that we have gotten accustomed to doing, especially tied into the bricks and mortars, that somehow we're still able to function. And, you know, we're actually asking ourselves these questions. Do we really need to do the things that we were doing earlier without really having more consideration for things like telehealth? Because right now I can tell you, the providers love it, the patients love it, and more people are saying, well, you know, unless I have something really serious going on, I don't see why I should be going to my physician. And from a hospital point of view as well, it's really, really helpful because we're able to stay connected to our patients in a way that perhaps was not necessarily as, possible before. But with this, it's opened a world of opportunities in an accelerated way and in a way that is really making us think and rethink our strategies, even down to office space. We're looking at scouting a building for corporate offices, but then now there's a question about, do we really need that? Seeing how successful you can say we have been with being able to move to a semi-remote, work location. So now, do we really need to have a building? So telehealth, I think, is here to stay, and if anything, I think it's going to get even more in demand.
So Régine, you made a distinct point at the very beginning when you mentioned virtual care, because those of us in the know, we actually do make this distinction between virtual care and telehealth. And virtual care has a whole series of implications, especially for the supply chain, because where we were used to getting supplies and materials into the facility, now we have this other channel, if you will, whereby which we may now have to get some of those same supplies and resources to a patient, regardless of where that patient is. And the question is are our supply chains designed currently in such a way to really be able to distribute those products in that manner while still having what we say this level of control in ensuring that the right people have touched it in the right manner and that we can also log that activity?
You're absolutely correct. And one of the things that I did mention earlier in the goals that I had for this year was actually one of those, because I'm of the belief that the supply chain needs to continue to evolve as well. We can't remain that traditional, supply chain of yesteryear. And so one of the goals that I had was to look into expanding supply chain all the way into the patient's home in a way that's going to support, the direction in which healthcare is going. And so you're absolutely on point with that. Supply chain today as it exists, perhaps not so much, but COVID-19 in a very interesting way has given us the opportunity to take a look into what that could look like and what we can do. So this is one of the things that I'm actively working on already, as we're looking at a post-COVID-19 world.
Cynthia, what about you? What are you seeing on the other side, if you will?
I hope we don't put the genie back in the bottle, actually, because it's been nice to see decisions being made rapidly with not a lot of committees and bureaucracy getting in the way of finally moving on things that I think people have wanted to move on for a long time. So from a healthcare perspective in the province that I live in, as an example, there's been a debate about how do physicians get reimbursed for virtual visits. And so it's never moved forward because they don't have a billing code for that. Well, I believe in about 48 hours that all changed here in the province that I live in. All of a sudden, the billing code was created for virtual visits because they had to. And just things like the nimbleness upon which organizations like Health Canada have had to move on, allowing for drugs to be imported that maybe don't meet the exact label requirements that we're all used to, but nevertheless isn't going to pose a risk. And even from our perspective, we're, well, not ideal, but we're moving ahead on keeping our business running by a small core group of staff. And I think the outcome is going to be as good as when we had hundreds of people assemble for a large meeting. So like I say, I think there's an opportunity for us to be more efficient from a supply chain perspective. A few years ago, we did a contract for home dialysis, and it was thought of as innovative at the time when supplies got delivered to the patient's home. But I think, as Régine has said, the way we contract and the way the logistics is going to work, it's going to look perhaps a lot more like Amazon in the future, because we may have more locations with smaller amounts of people providing the care that today is cared for in the hospital setting. So as an organization, I think we just need to set ourselves up to make sure that we're ready to take a new world on.
So Cynthia, you and Régine both had a common thread there, which is this whole notion of the changing expectations in terms in which consumers want to engage in the healthcare delivery system. And we have been fighting this tooth and nail. And I say we as an industry say, no, they really only want to receive healthcare one way, when in reality, we know that's not the case. They don't see the distinction between healthcare versus ordering a pizza versus ordering a pair of shoes from Amazon. The thing is, they want a seamless transaction and encounter. And now COVID has created this opportunity where now I think what we're going to see is more patients or consumers, if you will, saying, you've demonstrated that you can do it in a different way. So why go back to the old way that was highly inefficient and more costly? So we've now have what I say, we have raised the bar, if you will, in terms of what now healthcare has to continue to be able to deliver upon.
Yeah, and something that we're seeing in Canada and probably in the US as well, and it's kind of a sad story, but I think, a lot of money went into running hospitals, and maybe that's going to look a little different in the future if we move to more virtual care. But we have a whole set of the healthcare system around long-term care and nursing homes where it's very tragic, and a lot of the deaths that we're having. And I realize the criteria of elderly people, but I think we may have identified an underfunded set of the healthcare system that needs to be looked at in a very different way once this is all over.
So I'm going to take an accordion approach for just a moment. I'm going to broaden out the discussion for just a minute, then we'll focus back in. So I want you guys, and Gil, I'll start with you here. When you think about the various nodes in the healthcare supply chain, what are those areas that you think now have to some degree been exposed or highlighted as being extremely vulnerable?
Okay, so I've been thinking about this heavily in the last day or two, that what we know as traditional pharmacies, during this period of time, people were reluctant to go into a pharmacy to pick up a prescription because they know there might have been, other individuals in there that may not be healthy. Right. And they're probably thinking, hey, this mail order, ordering my prescriptions mail order seems to be working. I don't really need to go to that pharmacy and maybe expose myself to someone. So I think there's going to be, I don't know what percentage, but a shift to more mail order prescriptions and not running into the pharmacy, which is going to, again, the brick and mortar situation, like it's going to be in retail. People are finding the convenience of ordering, via the internet or however, they're going to market to get their prescriptions. So that'll be interesting to see. Won't change our overall business because, expiration will be expiration, but it'll change the dynamics of where the goods are. There's a number of big mail order prescription companies, and we deal with a few of them, and they're some of our largest clients.
So Gil, are you doing any direct to consumer in terms of this gathering of expired meds, or are you usually working through some other entity to do this? And do you see this as a potential change in your operations?
Well, under HIPAA and those type of things, we really can't be dealing directly. Even these kiosks, when we get back the product in the kiosk, it's in a black bag. We don't know what's in it. We're not supposed to know what's in it. So we just handle it and put it out to disposal at a pretty high disposal rate, because the incinerators say, hey, we don't know what's in there. Could be someone could have dropped bullets in there and we don't even know.
Yeah.
And so, we pay for that incineration dearly, but again, going directly, we really can't do that.
Okay. All right. So Cynthia, Régine, any of you want to weigh in on nodes that you think have been exposed or highlighted here?
I mean, I don't know that there's anything that's been exposed that wasn't exposed by a few things a while ago, like, the hurricane in Puerto Rico and I think that we discovered some time ago that there's not a lot of capacity in the system when we have to really ramp up to 300% and 400% of our volume. I think We've gone so lean, so JIT, in an effort to be efficient and to save money, that when the chips are down and we need 4 times what we needed last year, the capacity in the system simply doesn't exist globally. And that's something that manufacturers are going to have to really look at in the future. And organizations like ours that, do contracts and, price and efficiency is what we are always measured by, but mostly price. We may have to, understand that there's a cost to the leanness and the undercapacity that we have in the system. I mean, one of the things that we do in the pharmacy side of the business, we do a contract called a split award. So if there's 2 suppliers in the Canadian healthcare system, we will give a contract to both of them and split the business 60-40, so that we ensure that we keep 2 suppliers in the marketplace in the country in the event that one have a shortage. And we might have to pay a couple of pennies more, but in the long run, the cost of not having a drug, you almost can't put a price on it.
Right.
So I think those are some of the battles and the discussions that we'll have about the system going forward.
Okay. Régine, any thoughts on this?
Yeah, I mean, we've always talked about how, there are particular regions of the world, a particular region of the world very specifically, where we tend to source, the majority of our products. And that's something that, I know I've talked about that before, and many folks have talked about it before, but I think we never really truly understood the heavy reliance that we have on just one particular location.
Right.
And so it has become, in my opinion, this has highlighted, something that is somewhat unhealthy. Because, when you're looking at, even as you're diversifying your channels from a vendor or a manufacturer perspective, when you look deeper and you follow the breadcrumbs, it still leads to the same source.
Right.
So you may have 4 or 5 different suppliers, but they're all going in the same place. And so we're finding our way now where we're all flocking in the same direction for the same resources without having relief to go anywhere else. And, the prices are absolutely ridiculous that we're seeing in the marketplace right now, which in turn is definitely forcing all of us to look internally, to look locally, and to look, more nationally, instead of having that heavy, unhealthy reliance on really, one region of the world. It doesn't matter. I mean, I've spent countless nights in the past 4 weeks sourcing myself very specifically at night, calling folks and colleagues, in Asia, in Australia, in Europe, just trying to figure out, in Mexico, in South America, trying to figure out, is there an opportunity to get to other sourcing? And then it's just baffling to me how a lot of places are like, no, well, we have the raw products, but we send them over there and then they come back to us. So it still goes in the same direction. So that to me has to stop. We have to find a way. We have to come out of this with a clear plan and understanding on how we can fortify ourselves a little bit more, internally or locally or closer to home, with the understanding that it cannot be 100%. You can never be 100% because then you're shifting the problem the other way.
Right.
I think there needs to be a healthy balance of being able to have, different sourcing channels that are, pretty much spread across. But right now, I got to tell you, it is painful because you got millions of people flocking in one direction.
Mm-hmm. So, Régine, you've highlighted two things here. One, the thing we always hear, which is as supply chains have become more global, they become longer. But the part we don't talk about is the part you highlighted, which is they have also become extremely thinner. And what I mean by this is it's a funnel, right? You can have multiple sources of supply at the top, but the reality is they ultimately are going to that same point of origination. And when you get to that, it's not just a long chain, it's a very thin chain, which becomes a very fragile chain in the event, whether it's something that's man-made or something that's natural that happens. And at that point, you're saying, what do we do? And we become so reliant on these because it's a way to protect margins for various stakeholders in the supply chain. But now what we begin to realize is the protection of margins could very well have put lives at risk, lives that unnecessarily are being put at risk. And so I think this has implications even beyond just healthcare, because we're not the only ones who follow this. Yes, we might follow it more so than others, but the reality is I think this cuts across many types of industries and sectors. And so having said that, we have another question from a participant that really deals with this. And the question they're asking is, so what kind of preemptive measures pertaining to your supply chain practices do you expect that you would have to embrace to get back to normal practices once we move past this particular pandemic?
Okay, so preemptive measures, to me, it goes back to what I was saying. We've been spending a lot of efforts in the past 5 weeks now. We're 5 weeks into this, really looking at self-sustainability, a little bit more, a lot more than what we have done before. Also, anything from creating the process a little bit closer to home, all those things are things that we're looking at. In terms of normalcy, I don't see us being back to normal for a long time. I don't know what normal is going to look like. That may be another word. I don't know that we're going to go back to normal the way that we think normal is. Normal is going to be different. So with that, in order to continue to maintain an edge in the supply chain, one has to be extremely resourceful. You're going to have to look at, utilizing some of your network in a way that you perhaps did not think before. We're going to have to be a lot more transparent with each other in terms of how far into the supply chain we go together. To your point, Randy, this whole idea that, like you said, it's become long, but it's also thinner. I mean, I look at it sometimes like this diamond, it's like, it looks like it's wide, but then it goes in. It's like really one single source. So I'm trying to get away from that whole idea of just one single source. So in many different types of ways. So what can we do? And it's more about asking ourselves the question, what are some of the things that we can lean on? Like, for example, the thing that has been absolutely enlightening and amazing has been able to see how the community around us, we've been sitting on gold mines of talents and opportunities that we never even thought possible. So, and I know you guys have heard those stories all around, but we were one of the first folks who actually, in New Orleans, the Mardi Gras industry, you guys know it's a huge thing. So we have people round the clock who are making costumes and elaborate things. And those people found themselves out of work. And, we started to have a different dialogue with them. Even they didn't think possible. And now these people are in the business of making gowns and masks. And I got to tell you, those gowns and masks that these people are making, they rival any gowns and masks that you have seen in the industry. And our providers are raving about them. They love them. They're just everything that you wouldn't even think that you would have access to. And yes, you're paying a little bit more, But at the same time, for example, they're reusable, and it's closest to home. So we're working now. So we're planning to invest as much as we can, to stand up at least a portion of the operation where I don't have to worry about gowns and masks in a way that I was before. Right. Even if it's 5% of them, I can get them from there.
Right. Yeah. So you've identified this emergency source of supply as a result of this that could ordinarily become now a traditional channel of supply for you as needed. So Cynthia, what about you?
I think it's going to be really interesting. The same thing's happening in Canada where we're seeing, people that normally make gin, all of a sudden they're making hand sanitizer and, people making masks and gowns. Now, eventually they're going to want to go back to making gin, I hope. So, we're still going to have the suppliers that we have for hand sanitizers. I think the interesting thing, and I don't know how it's going to play out, is we're going to have a lot of emotion around. We're going to want things made at home in Canada, in US, in our provinces, in our states. But we are also a part of global trade agreements. So there's going to be a conflict between, we are a global world, whether we like it or not. And if it's been a challenge if it's a challenge now, it is, but we still do have global trade agreements that we're a party to. So we're going to have to really be careful as a contracting organization for Canada, how we lead our members and our healthcare providers to make sure that we're not doing anything that is essentially against the law to a certain extent, in the emotion around wanting to support local suppliers that were there for us during this time. So I think that is just an interesting observation that we've made of what we're going to be talking about sometime in the future.
So Gil, I'm going to turn to you now and ask a slightly different question. And this one primarily has to do with, the touting of hydroxychloroquine, and other anti-malaria drugs as a mechanism or intervention that could potentially help to curb the symptoms associated with COVID. So when you think about this, what has this really meant for Pharmalink, if it has had any implications on what you're doing?
It's interesting. The day that word hit that this malaria drug might be, a resource for curing people, I went in and looked up how many companies in the U.S. have licensing to manufacture, and there's a ton. But the hydroxychloroquine still hasn't been proven that it's the solution. The effect it'll have on us is if a lot of people, try to stock it and buy and bring it in, and then it proves not to be, we'll get returns.
Right.
That's the kind of effect it'll have on us.
So Cynthia, I'm going to ask you also a slightly different question, which incorporates one that we have coming from a participant here. And we've had this conversation around the importance of national aggregation and alignment. In your perspective, has that made a difference in terms of dampening the impact of shortages or not?
Yes and no. So the demand that we're seeing during this COVID-19 is, I think, unprecedented. We've had shortages before, but it's never been during a time where there's been a 400% increase in the drugs that you need to treat COVID patients, as an example. So I think we've done some good preventative things. So we've always been a proponent of multi-supplier awards, where we encourage that there's multiple suppliers of various products in the market at all time. On the pharmacy side, I agree with Régine. Sometimes we think we have a contract with 2 suppliers, but then we find out that the API is just coming from 1 supplier and somewhere in the world. And so we really don't. We put together, after Ebola, a series of pandemics supply agreements, which really were with multiple suppliers that had PPE at a set price, so that when there is a shortage, there would be limited, no ability to sort of price gouge. But I would also say that the products available within those suppliers were quickly grabbed up when all of this took off. So I don't know that national aggregation has been able to do anything to suppress the demand that we've seen as a result of COVID-19. But I like to think that our strategies of making sure that we kept multiple healthy suppliers in what is a very small market in Canada alive and doing business, so that we didn't run out of supplies in the first day that this was encountered. I mean, as Régine, whether you know how small we are now, not, I always like to recount a story that a supplier told me once, that all the exam gloves in Canada that we use are the same amount that's used only in the state of California. So that's how small we are, and that's why it's so important that we have multiple suppliers in this Canadian marketplace.
So
but
Régine,
as far as
go ahead, Cynthia.
people needed what they needed, and things that you wouldn't have even expected they were going to need, because the way practice has changed in treating the patients, we're seeing even things like food put on allocation because certain frozen products come from Asia, and it's just affected absolutely everything that we do at HealthPRO.
So Cynthia, you know, one of our colleagues that we have in common, Ann Snowden at the University of Windsor, who's extremely well known for the work she's been doing in the healthcare supply chain as a major proponent of this. One of the things that Ann and I were talking about is national aggregation is great, but in times of a pandemic, do we really need some type of mechanism or unit that can serve as a face for global aggregation, so that we can then ensure not only do we have access to all the things that are going to be needed, but as we see the shifts in demands across the globe, we can now reorient those supplies and get them to where they're needed to try to prevent hoarding.
Definitely. And actually, when we sort of saw this bubbling up, one of the things that we did was reach out to our suppliers and make sure that they saw it bubbling up too, so that we could start putting organizations on allocation. Because the last thing you want is to have any one organization taking a stockpile of product where they're not the hotspot and the hotspot doesn't have anything. So in pharmacy, we have played a fairly active role with our VP, meeting with provincial and federal government folks, helping them understand what the national volume is, and then working with the suppliers to understand how much they can ramp up to meet the demand that we're going to have, identifying the gaps. And then we really think it's government's role, because when you have to start making ethical allocation decisions, you know, somebody was at a meeting once and said, the participant said, nobody wants to be the one that plays God. But it's really got to be somebody that takes a leadership role, I think, probably in government, to be making these decisions on A, where's the hot spots, because you need the information to know where they are.
Right.
And B, how do those products then get reallocated to the hotspot? So yes, there could be a role for a national or a global organization that manages supplies under a pandemic and mitigates the price gouging.
Yes.
That's been going on, where, you know, provinces and countries are competing against each other for the same product, and it's only the seller that's benefiting from it by getting, you know, I don't know, $10 for a mask that normally costs less than $1. So there's something wrong with that for sure.
Right. And we talk about health disparities that are global, not just in one country. And yet what this creates is that opportunity where that chasm between the haves and the have-nots grows, and developing nations are the ones who tend to end up suffering the most and unnecessarily, unfortunately.
Right.
So Régine, I'm going to, go ahead, Cynthia. Sorry, you were saying something.
We've said that we think that when all this is over, there will be warehouses all over the place,
yes,
full of PPE to the brim, I suspect.
I agree with that. So Régine, you are a rarity in the fact that you sit in the C-suite as the senior supply chain leader. And not only is that a rarity in healthcare, we find that that's a rarity across many sectors. And although we believe from our position as the Global Supply Chain Institute that any organization worth its salt that values supply chain and views it as a strategic asset should have a role in this C-suite for someone who occupies it, has that level of acumen. So I'll say this to you, in light of what has manifested, what have you seen in terms of the perspective of your non-supply chain C-suite members and their appreciation and acknowledgement of the vitalness of supply chain to ongoing operations?
Well, I have to tell you, in a very weird way, I am relishing this whole COVID-19, because all of a sudden, I know I used that term earlier, but all of a sudden supply chain is sexy. People love everything about supply chain because they have all of a sudden woken up and realized how important and integral we are to everything that happens in the hospital. So So, it has been a little bit of a humbling thing, not only for me, but also for them, to realize that at almost every point during the conversation, they had to turn to me and say, Régine, what do you think? Régine, what can you do? And of course, my ability to also network, and I feel like I have a really deep network, has also helped out, even in areas that you don't necessarily think about. And back in December, going back to the December thing again, I was working on somewhat of a rebranding of the supply chain, where I was saying that, I see supply chain, we are facilitators. And what that means is that we will facilitate you getting what you need. It doesn't matter what it is. We are those people who are going to facilitate and who are going to get you. And we fill the hands that heal. So whatever that means, that's what we're going to do. And that has come back now full circle. They're like, boy, are you ever a facilitator? So I just have to say that, across the organization, there's a sense of really deference to the supply chain just generally, but also it's also been an opportunity to communicate a lot closer with other areas, again, that thought that they were an island, and now people are coming together really intentionally to try to come up with a solution, to try to come up with things that are non-traditional, but it's just almost like a sprinkle of magic dust that has happened with this horrible thing. Has come out some really wonderful opportunities for us to really collaborate internally and also with others. But I just got to tell you, supply chain is riding high right now, and I'm loving it.
All right, that's good to know. So Gil, I'm going to come to you with this next question. And when you think about what's next, think about where we are, where we could be, and where we absolutely need to be. So whether we're talking about decisions that are strategic, administrative, structural, you name it, what do we have to do today, decision-wise, to make sure that we have a more resilient global healthcare supply chain in the future?
I think, first of all, we have to look at protecting our employees, making sure that, every company has the proper sanitizing, the proper, handling of equipment and the touches that go between people, that they're handled properly so that we're not passing this on. Understanding the impact of receiving product. Even today, we talk about, do we touch the cartons that have come in? How long have they been in the supply chain, and how long, could the virus last on them? We don't know where it's been and how it's been touched, and do we just, leave it for that period of time? So it's more about, being resilient from a standpoint of protecting our employees so that they stay healthy and keeping, a steady workforce. And, we purposely here have tried to find things for the shortfall and not say, hey, people, we don't have enough work for you. So this is a period that we've never had before. We're cross-training people. We like everyone to understand every job that we have in our fulfillment center and learn it so that when we have shortfalls, we have people that can do every job. So we're taking advantage of this period. But again, I think it's protecting, the employees going forward and making sure that, that none of this is passed on and that people stay healthy.
Okay. Cynthia?
I think really it behooves us to make sure that we understand what the redundancy in the system is of the suppliers that we're doing business with. And our role is really going to be to ensure that we have as many healthy suppliers in the global marketplace as we possibly can, so that we don't wake up one day and realize that everybody is all just using the same supplier. And we have a role to play through our contracting organization. And we've really been sort of cautious to not make it mandatory, as an example, that a pharma supplier tell us who their API providers are, and it's all confidential. Well, maybe that's not okay anymore. And so we probably need to have some serious discussions about how far we push for more transparency in the supply chain going forward.
Okay, Régine?
Yeah, I would definitely agree about the transparency, because when you asked the question, I was thinking about that almost immediately. The idea that we need to go deep in we've been talking forever about, creating those partnerships, and, now it's really time for us to look at creating those partnerships, capital P and capital A, capital R, the whole nine. We're going to need to really find a way to understand what the vulnerabilities are in the supply chain. And I keep talking about diversifying the channels and making sure that we have at least, more than one source of something. And also at the same time, challenge the status quo. Challenge the things that we have taken, for convention, and even challenge the things that we're doing, the things that we're utilizing, the things that we have come to really love. Do we really need to do this way? Do we need to use that? Can we look at doing things differently? Like for me, the opportunity that I'm going to look for after this is I'm going to lean in a little bit more, even on my physicians, about, some other practice. And so it's like, okay, guys, this is time for us to really take a look at the way that we've been doing business and the way that we've been treating our patient. It's an opportunity to look at the path, the pathways of care. Are we doing everything that we need? Are we being wasteful? Are we not looking at something that is right in front of us in terms of a particular, way of treating a patient, a particular way of doing something? All those things we're going to need to continue to ask ourselves the question and come up with an answer where we're going to be able to pivot and create, new normals, new nodes, new channels of things, because right now, it's really pretty stale. And because of everything that's going on, I don't see us coming back for a while, if that's ever really going to happen. So I think we're going to need to continue to challenge ourselves and be more flexible, more agile, and, cut through the red tape and just, get things done.
I agree. And I think all three of you hit on extremely vital points that all supply chain professionals need to be mindful of as we move forward. So as we begin to bring our conversation to a close, I just want to reiterate a few points that I've heard. Cynthia, you talked about the need for transparency, or greater transparency in the supply chain. And with respect to that is this willingness to share information and to dialogue with those that we might even consider to be our competitors. So this whole notion of coopetition is going to be vital if, in fact, we're going to build out a more resilient supply chain moving forward, which also then brings about this opportunity to increase the visibility at multiple tiers within the supply chain, going to Régine's earlier point, so that I may have multiple suppliers, but it's still only a single source of supply. And so being able to identify that so that we can build in these risk mitigation factors. The other thing, Gil, that I've heard you point to, in addition to protecting our employees, is making sure that we understand that risk management isn't a side thing. It needs to become a core capability with respect to any and every supply chain. And it has to be something that every supply chain leader and professional has to take seriously in the event that we have, whether it's another pandemic or whether it's a natural or man-made disaster. Risk management is at the core of all that we do as supply chain professionals. And then last but not least, it all starts with the people. It's the people who are the boots on the ground, whether they're driving the trucks, whether they're moving the trains, whether they're steering the ships or the barges. It's all about protecting and investing appropriately in our personnel who enable us to have the things in our hand. As you say, we feel the hands that heal. And even if we move beyond a healthcare dimension, the reality is at some point, everything that's being produced is going to be consumed by another individual. Am I concerned more about the process and not about the point of consumption, or vice versa? And so we have to begin to realize that they should be on equal and level playing fields. And so having said that, I want to thank Gil, Cynthia, and Régine for your time this morning. I think those of you who joined us in this session today, and we hope that you had some great insights and nuggets taken away from our fabulous panelists. I have enjoyed the moment to share the platform with these three distinguished individuals. And again, I want to remind you that tomorrow, 10 a.m. Eastern, Marianne Wanamaker talking about the implications of COVID on the U.S. economy. We look forward to you joining us then, and we hope to be back with you soon. Thank you for coming. We're at the end.